Hello. I'm talking about chemsex or party and play culture, which is a particular kind of drug use phenomenon, particularly unique to gay cultures around the world, I guess. So it's about gay sex happening with the use of drugs, usually crystal methamphetamine and GHB or GBL, and in parts of Europe, methadone as well, or cathinones. Those particular drugs used by gay men in sexual contexts has become quite a drug use phenomenon, specifically associated with like gay sex, bathhouse culture, or hooking up culture, using apps like Grindr, and the availability of these drugs and the normalization of chemsex, PnP, on those platforms. And even though there's a whole lot of people that use these drugs with sort of low harms, or that you might not see them in healthcare services, or they might not be wanting help with their drug use, there are very large numbers of gay men who are needing support, and we're needing our health services to be sort of up to scratch on the cultural contexts of it. So PnP, party and play, or chemsex culture, is specifically crystal methamphetamine, GHB or GBL, methadone in some parts of the world, by gay men in sexual context specifically. There's different kinds of drug use epidemics that we're familiar with. We're familiar with the opiate or heroin epidemic. We're familiar with the heterosexual use of methamphetamine in parts of the world too, which has a particular cultural context and is often associated with extreme mental health, poverty, and again, exposure to the normalization of the drug. There's the crack cocaine epidemic, which is, again, very much related to injustices within the criminal justice system at the time and social concepts of racism at the time, politics. And chemsex is just another drug use phenomenon, particularly affecting a drug population, and people are needing some support with it. So where it's a bit of a problem is that chemsex is falling between the gaps. Is it a gay sex issue, so we leave it to the gay charities to work out? Or is it a sexual health issue and we deal it with the sexual health and HIV clinics to deal with? Or is it a drug use addiction issue and we leave it to the substance misuse services to deal with? Is it a mental health issue? Because some of these things are challenging for different healthcare settings, quite often we fall between the gaps, as in gay men or people who are engaging in chemsex fall between the gaps. And so it's really, really important for different services, different healthcare services, particularly in regard to chemsex and PnP culture, to liaise and work really well together. For instance, a gay man's charity might be able to talk about gay sex really easily. So it might be a really good place for gay men to go to say, I'm engaging in chemsex or PnP and I want some help with it. And the staff in that setting might be the right place because they feel comfortable talking about gay sex. Maybe they have the skills to talk about setting boundaries within sex, or how to write a Grindr profile, or how to reflect on the sort of sex you really want and how to make it happen, how to put boundaries in place. But they might also be needing the expertise of a substance misuse service or a drug use service or an addiction service, where it's better understood. They might not understand the gay sex context very well, but really understand what it's like when a person is psychologically dependent on a drug and keeps on using it, even though they plan not to each week, and they keep on doing it. And they need help with the motivational interviewing and the CBT and the other kind of therapies, and just the cultural understanding of what addiction and making choices despite oneself, what they can be like, and how to help a person to make changes in that regard. There's also the sexual health and HIV. So there are cities in the world where, and groups of people that don't have great access to healthcare, or because of cultural reasons have stigmas that prevent them from hearing messages about HIV prevention or HIV care or access to medicine or adherence to medicines. And in those cities and in those cultures, chemsex can be one of the main reasons that HIV continues to be an ongoing problem and the transmission of HIV. And so, again, we can't just leave that to the HIV services of people who understand HIV prevention messages, or HIV care, or pre-exposure prophylaxis, post-exposure prophylaxis for HIV, and other HIV prevention methods. Those services might need help from other services to talk about the gay sex, or to talk about the addiction parts, or the behavioural, psychological dependence, or even the physical dependence. GHB is a physically addictive drug, and there are many people who form physical dependencies to it. Drug-induced psychosis is a very common side effect when a person stays awake for 1 or 2 or 3 days on crystal meth and GHB, chemsex. And understanding the drug-induced psychotic presentation of a person at the end of those 3 days and how to manage it is another skill where we as different services have to come together and share our expertise with one another. We have to find out where is the right place to host chemsex PnP support. Is it the place where gay men are more likely to feel confident to talk about gay sex, are more likely to access and find as barriers to healthcare? If that is the case, then do we need to get some of our addiction expertise into those places so that we can share some of that? Do we need to make sure that those gay charities have really good relationships with HIV care and prevention services so we can make sure that the HIV epidemic management within our city is culturally tailored and aware of where gay men are seeking support with this kind of thing? My main point is interagency work. It's just so important. It's so easy to say, it's a gay sex issue, it's not my problem. Or to say, that's an addiction issue, it's not our problem, it's for the addiction services. Or that's an HIV problem, that's a problem for them. And even though we might be sending our patients or our clients to those services to get that addressed, there are gaps in the other kind of the holistic care that is required for a person to stay healthy and well informed and safe from harm when they are engaging in chemsex or party and play culture, PnP.